The use of virtual simulation in nursing education is growing rapidly, and the new age of technology has impacted many nursing programs. These three-dimensional virtual reality scenarios place learners in the central role and create an imaginative, real-life situation to help integrate learning into clinical practice. My name is Amy Bailey, and welcome to this video on virtual simulation. Simulation techniques were actually introduced in nursing education in the 1950s and have evolved greatly over time. As our healthcare system advances, so has the revolution of technology in education. Electronic medical records, computerized charting, and patient care delivery have changed the landscape of nurses' work today. Education must also conform in order to align with this tremendous shift. How does virtual simulation work as a form of assessment? This is a user-friendly and valuable assessment technique for both the teacher and the learner. It offers a virtual experience in the form of an animated and interactive nurse-patient scenario, placing the decision-making in the hands of the students. Learners are able to interact with the patient, review data, select actions, and prioritize care. Teachers can facilitate reflection and measure students' progress by incorporating this in the classroom or the lab, or simply assign scenarios in preparation for clinical practice. There is a variety of standardized scenarios that mimic real-life patient events. Examples might include health assessment, medical surgical nursing, and pharmacology-focused practice. It generates an evaluation report and provides learners with rationale for incorrect answers. Remember, students always want to know why. Let's take a look at an example and meet Sage.
Hi, my name is Sage. I'm 14 years old. I don't feel good. I hope you can help me.
Students can navigate through this scenario and choose how to prioritize the care for Sage. Now let's take a moment to consider how you learn best. The chalk and talk methods of traditional teaching styles have evolved into more of a learner-centered approach. The purpose is to produce the highest quality of student learning. These interactive and computerized programs have begun to change learning processes and have challenged students and motivated them to actively engage in their education. Learner-centered education shifts the focus of instruction from the teacher to the student. So what's the impact of this type of assessment? The introduction of simulation has produced a significant improvement in nursing education. It prepares students to practice safely and accurately in clinical settings. Virtual simulation provides context-based learning that is engaging and meaningful, and it can be conducted in comfortable settings that help to decrease anxiety. Students learn to work together and collaborate with their peers through problem solving and the sharing of ideas to better understand the importance of teamwork. There are a few limitations. Although there is a number of free resources, the standardized versions have a cost, and funding in post-secondary institutions may not always be available. Secondly, students often want some kind of reward for their learning, and because this is not a formal evaluation tool, self-motivation may discourage its use outside of the classroom. Finally, the scope of practice and desired learning outcomes should be carefully considered, as these activities are directed for nursing students at various levels of learning. The advantages, however, are promising and provide students and teachers alike with effective assessments of learning. Students can work at their own pace and in an environment that is safe and comfortable, where they can learn from mistakes and enhance their critical thinking skills. Well, Selvig published a study in 2018 on the use of virtual simulation as a form of assessment and found that a high number of students perceived this learning tool as an effective strategy. These learning assessment strategies are based on the theory of constructivism, where knowledge is the product of interaction and students are active in their learning. Theories also support that providing nursing students with opportunities of different virtual clinical scenarios helps to enhance the development of clinical reasoning skills prior to the contact with a real patient. There are several ways to obtain student feedback. We can use surveys, discussion forums, or group debrief sessions. Instructor-facilitated debrief sessions help to connect the teacher and the student. They provide a picture of student learning, gaps of knowledge, and ability to assess student progress. It provides the learners with an opportunity for reflection, which is the cornerstone of the virtual learning experience. Digital revolution is among the trend in nursing education. It provides a more experiential learning opportunity and is an effective assessment technique.